In the 8th grade, I was the lead in my school plays, as well as the captain of my wrestling team. By 9th grade, I was starting to spend more time in hospitals than I was in the school setting. I had to start doing my schoolwork in the hospitals and have teachers come to my home over the summer to try to stay caught up with my classmates. I was able to graduate, and I graduated with honors before finally getting my registered nursing degree. Used that degree to become a psychiatric nurse at the same hospitals that I received care as a youth. We don't have many facilities in the area, so it wasn't intentional that it ended up being that facility. It was an added bonus to be able to kind of be in the same place where I was as a teenager who was sick. Back then, when that started, though, you didn't really tell your coworkers, so nobody knew I had a mental illness. It wasn't something that, kind of like it is now, I kind of had to keep it a secret. And that's in the early 2000s that was all occurring. I was someone who was on the front lines anytime someone was having agitation or a crisis on the unit, and I would go to whatever floor required my service. Around that time, I got sick again. I have bipolar disorder. I had to leave my job and get electroconvulsive therapy, which is when they shock your brain. And I actually got it done at the same hospital I was a charge nurse. A lot of the people that I worked with were now also providing me pretty intense care measures. As I started to get better, I originally wanted to be an educator. I wanted to work with youth. And as my life became more and more consumed by my mental illness and then ultimately mental wellness, I started getting pulled towards wanting to work within the psychiatric facilities. So then I became a certified peer support specialist, which is someone who works within the mental health system, who's in recovery. And you're not a therapist, you're someone who tells another person suffering, and you work with them more as a peer. But I got sick again and I ended up on disability. And when I was on disability, I decided to start advocating. I wrote 3 books. I also started speaking to local schools and local colleges, future police officers, future nurses, future teachers. I found the most success in college, and it's similar to what I'm doing right now. I try as quickly as I can to give my story, and then let's talk. I'm usually speaking to college students who are going into human services in one way or another, whether their questions are about their own personal experiences or how to best help people that they're going to be met with. This is something that we all deserve a right to speak about, because adversity and suffering are not unique solely to the mentally ill. If you are a healthy person, you will still suffer, you will still feel grief, you will still have bouts of depression, you will still experience anxiety. So it's important that that's also validated in our entire community. I never want someone to feel like, oh, mine isn't as bad as yours, so I should discount or dismiss my suffering. Suffering is worthy of validation. It's worthy of sympathy. I like to encourage our youth to learn more about themselves. Just think that that's one of the most important pieces for me, is start inside. Know you. We've gotten really good at kind of looking out and assessing, but if we don't have that clear vision of ourselves internally, not just our identities, but how do I act when I'm scared? How do I act when I'm embarrassed? How do I act when I'm hurt? That's a huge piece of what kind of saved me. That's what I want to teach. I think the best way to teach that is through discussion and allowing people to ask questions, offering them different thought processes where they can start to inspect themselves. We need to teach those basics to the entire society, to our people, so that they understand them. I was ready to go in and just start talking about this really important subject. Doing all of those things, I continue to do simulations. They're called crisis de-escalation simulations, where we bring nursing students into the room. I start to get agitated, and they have to practice feeling that confrontational energy and calming me down. And the hopes are that they learn how to do some of this prior to graduation. Every month I go into a psychiatric facility and do healthcare assessments for the people who are actively receiving care. Find out if they have transportation. Is your insurance covering your needs? I also don't get paid to do that. I've been doing it monthly since we were allowed back in hospitals after the pandemic. That's a lot of what I've been doing. I haven't been chronicling on social media which is why I was surprised about the Jefferson Award. I haven't actively tried to be seen doing it. There's such a need for help right now. We're living in a different time. So if I denied everybody who couldn't pay me, then I would be denying aid during a time of need. And that's something that I've refused to do. And I continue to speak to future criminal justice majors. Any chance I get, I'm trying to get out there and help. I'm the chair of our county's mental health advisory board. I've devoted my life to this field, whether it's been as a patient or a professional. For as many people as are telling their stories, we're often telling our stories about when we were sick. And there's lots of stories about how difficult being better is. Because even though we are all a little more comfortable and free to share our stories, younger and younger people are experiencing some extreme suffering, something that really requires addressed in the now. I first spoke in an elementary school classroom in 2009. So this is all momentum, even though it's not always being paid for. This is momentum. The holistic view of the human being, how the mind and the body are connected, is very true. I think we've become more comfortable and more aware of being able to share our stories when things are at their worst. But even that climb back, there's lots of misperceptions, and to be willing to take on whatever is necessary and continue to move forward in spite of adversity. And that's the type of awareness I want everyone to have, beyond just the mentally ill populations, whether they're mentally ill or not. For 25 years, I've been in the mental health system either as a professional or as someone utilizing the services. Let's figure out ways to teach people before their life falls apart. Our local chapter, we're in Cumberland, Perry County. We do an annual walk to gather the community, and whether you're someone who suffers or you know someone who suffers or you're just someone who is sympathetic to the cause, geared towards bringing the community together, bringing people together, and doing something that is non-confrontational and still proactive. A walk is just another example of something that creates change slowly. Change is something that takes a much longer time than many of us may be comfortable with. You know, that whole competition of service and all that, I have no problem with it. But I do believe when things get rough, that we all need to come together, combine our resources, and just try to fix the issues that we're facing. I hope that it is a lifestyle and a mindset that we can encourage others to consider, who choose to do it anyway because the need exists. Because we kind of need people who are willing to have a service mindset at this moment. The numbers of crisis calls are going up. Suicide rates are staying the same or going up in all age groups. So, you know, these things are really happening. And just talk about wellness. These tools can help us be well.